Hi, my name is Maya. I'm going to be your nurse for today. Can I get your name and date of birth?
Maggie Miller Key 91703.
Can I get your height and weight?
I am 5'3", about 140 pounds.
Okay, and then can I get your BMI?
23.
Perfect. So, did you come in here today for any specific reason? And are you experiencing any pain?
No pain.
Okay, if you were experiencing pain, we would give Maggie a numerical pain rating scale, 0 being no pain, 10 being the worst pain she's ever experienced. So, since you have no pain, do you mind if I do a quick 15-minute head-to-toe assessment on you?
That's fine.
Perfect. Do you have any known allergies?
No.
Okay, not to any medicine, food, environmental factors?
No.
Okay, perfect. So, before that, I'm going to assess your level of consciousness. So, what's your name?
Maggie.
Where are you?
Regis Lounge.
What time is it?
Almost 11.
And why are you here?
To film the head-to-toe assessment.
Perfect. So you are alert and oriented ×4, which is the standard. So by just looking at you, you have good posture, you are sitting good, you're dressed appropriately, you don't look like you are in distress, you look like you're pretty emotionally stable. How is your gait?
Good.
Can you please walk back and forth for me? Just to assess how you're walking. Okay, great. Gait is perfect. So I'm going to start off by looking at your face. You have a good skin color for your race. You are a little pink, which is normal. Your facial features are all symmetrical. Your eyebrows are symmetrical. Your eyes are round. Your nose is in the middle of your face. Your lips symmetrical. Your ears are symmetrical. Your eyelashes are looking very well distributed to protect your eyes. Could you raise your eyebrows for me? Could you smile? Could you frown? Okay, your facial nerves are working and they are intact. I'm going to start off by assessing your skin. So let me just feel. Okay, temperature is good. You have no visible lesions or rashes that I see. Can I please see your hands? I'm gonna assess for turgor. Okay, good. This looks like you're well hydrated. Now I'm gonna do your capillary refill. Okay, under 2 seconds, which is perfect. I'm going to test your strength for your arms. So up and then down. Okay, good. And now I'm going to look at your ear. Okay. Are you having any hearing loss, any hearing aids, anything of that nature?
No.
Okay, it looks like you have 2 piercings, 1 on each ear. There's no purulent drainage or anything coming out of the ears. Now I'm going to assess your hearing, so if you don't mind just looking that way, raise whatever hand you hear me whispering out of what ear. Okay, your hearing is there, so perfect. Now I'm going to assess your eyes. So I'm going to, well first I'm just seeing that they're symmetrical to each other, and now I'm going to assess for perla. So your pupils are round. Now let's see if they react to light. Okay, perfect, they're round, they react to light. And now we're going to see if they accommodate. So look at the front finger and then the back finger. Perfect, and then the same thing here, front and back. Wonderful. Now I'm going to assess your mouth. So could you open wide? Okay, your lips are a good color, your gums are intact, your teeth look great, your tongue is good, and say ah. Okay, your tonsils are a +2, so they're not too big, which is a great finding. Okay, so do you mind if I take a listen to your lungs? Perfect.
Go ahead.
Oop. Okay, so right now, I am going to try to assess for any sort of abnormal breath sounds. I'm going to be doing 14 breath sounds total, 6 on the back, 6 on the front, and 2 laterally. Is that okay?
Mm-hmm.
Okay, can you sit up for me? Just take a deep breath every time I place it. And then I'll do your lateral. And then 6 up front. Perfect. Your breath sounds normal. There's no crackles, no ronky, no wheezing, nothing of that sort. Taking a look at your head shape is normal. You are looking very symmetrical. Your hair is intact. It's looking healthy. There's no cracking. There's no dandruff. Nothing of that sort. Are you having any issues with the scalp or anything like that?
No.
Okay, perfect. Now I'm going to assess your heart. So I'm going to start off by feeling your carotid pulse on both sides. Okay, great. It's not too hard, it's just steady. I'm going to take a look at your neck. Your thorax looks like it's in center. I'm going to palpate there. Okay, it feels good. It is in the expected sightings. I'm going to palpate your radial pulse. And then lastly, I'm going to palpate your pedial pulse, which you have shoes on, so you can keep those on, but I would have done that. And now I'm just going to listen to your heart. So I'm going to do the ape to man. Okay, your heart sounds normal. For time's sake, I'm not gonna auscultate for a minute, but I would have if otherwise. Looking at you, your posture looks good, but I wanna test your range of motion kind of. So could you roll your shoulders back? Could you roll your shoulders forward? Could you move your head side back and forth and then up and down? Okay, your range of motion is good. Could you do the same thing with your wrists? Okay, your wrist range of motion is great. Your legs. Perfect. I'm just gonna look at your legs real quick. Color looks good. I'm not seeing any lesions or any abnormal findings. The temperature of the legs are great. So now I'm going to assess your bowels. So if you wouldn't mind laying down. Okay. When was your last bowel movement?
Earlier today.
And when was the last time you ate?
I had dinner about 2 or 3 hours ago.
Okay. And last time you voided or urinated?
About an hour ago.
Perfect. And anything abnormal going on with that?
No.
Okay, so I'm just gonna listen to your bowel sounds. An expected finding would be to hear things going on. Okay, I definitely hear things, so your bowels are active and in great range. So now I'm gonna palpate, because if I palpated before I auscultated, there could have been a false accuracy. Okay, as I palpate, do you have any pain?
No.
Okay, there's slight tenderness. I feel a great muscle tone, so everything is looking great. Do you want to sit back up for me? I'm going to test the strength of your legs. I'm going to first feel. Feels great. You want to go up, back down, and then up, back down. Okay. When I was looking at your nose, I don't see any drainage coming out. Can you plug one nose and breathe in, and then the other and breathe in? Okay. Have good patency. So I assessed your eyes, your ears, your nose, your mouth, your neck, bowel sounds, cardiac, respiratory, and I think we are all set. Do you have any questions for me?
No.
Okay, I'm gonna lower your bed to the lowest position. I'm gonna perform hand hygiene, place your call light here, and in case you have any concerns or questions, you can just hit that and I'll be right here. But your head to toe assessment is finished, so thank you for your time.
Thank you.